Welcome to the Exercise Classroom, your source for anatomical, biomechanical, and practical exercise education. Today's lesson: the lying leg curl. Introduction. The lying leg curl is an isolation exercise that targets the hamstring muscles through knee flexion. It is performed on a leg curl machine in a face-down, prone position. The prone body angle allows strong peak contraction of the hamstrings at the top of the movement. It's also called the prone leg curl or prone hamstring curl. This exercise is valuable for improving hamstring strength, muscular balance with the quadriceps, and injury prevention in both athletic and fitness training. Body contour benefits. Strengthening the hamstrings helps define the back of the thigh and contributes to balanced lower body aesthetics. It also helps reduce the visual and structural dominance of the quadriceps, leading to a more symmetrical leg contour and improved posture. The movement. The primary joint action in this exercise is knee flexion, where the lower leg moves toward the back of the thigh. The lying leg curl improves hamstring control and strength, which supports running, sprinting, jumping, and deceleration in sports. It also aids in protecting the knee joint from injury by balancing the pull of the quadriceps. Exercise execution. Lie face down on the leg curl machine with the pad resting just above the heels and below the calves. Align the knees with the machine's pivot point and grip the handles or pad to stabilize your body. Exhale and contract the hamstrings to curl your heels upward toward your glutes while keeping the hips pressed firmly into the bench. Pause at the top for peak contraction, then slowly return the legs to the extended position with control. Proper technique. Keep hips down, core braced, and feet in a neutral position throughout the motion. Use a full range by lowering the weight completely without locking the knees and raising the heels as close as possible to the glutes while maintaining control. The most common mistake during the lying leg curl is lifting the hips off the pad to cheat the movement. This reduces hamstring isolation and shifts tension to the lower back, decreasing effectiveness and increasing injury risk. Muscle mechanics. The exercise begins with a concentric contraction of the hamstrings as the knee flexes. As the legs return to the starting position, the hamstrings perform an eccentric contraction to control the downward movement. The gluteus maximus and gastrocnemius assist slightly depending on individual positioning and load, while the core stabilizers help maintain body alignment. Primary movers. The hamstring muscle group, including the biceps femoris, semitendinosus, and semimembranosus, are the primary movers. These muscles originate at the ischial tuberosity of the pelvis and insert along the tibia and fibula, working together to flex the knee during this movement. Other muscle roles. The quadriceps femoris group acts as the antagonist by resisting knee flexion and controlling extension. The gastrocnemius assists knee flexion, especially at shorter muscle lengths. The gluteus maximus and erector spinae stabilize the hips and spine, preventing unwanted movement during the lift. Biomechanical considerations. Keeping the hips firmly down on the pad is essential to maintain tension on the hamstrings and avoid recruiting the lower back. The lower leg pad should rest just above the heel and below the calf to ensure proper force transfer and minimize stress on the knee. The knees should align with the machine's pivot point to match natural joint mechanics and reduce torque or strain. Maintaining neutral or slightly plantar flexed feet can influence the contribution of the gastrocnemius versus isolated hamstring action. Effectiveness and optimization. Aim to bring the heels as close to the glutes as possible to fully activate the hamstrings and challenge them through the end range. Control the lowering phase to increase eccentric tension, which supports muscle growth and injury resistance. Hold briefly at the top of the representative to emphasize the contraction and maximize time under tension. Use a weight that allows complete control without hip lift or speed compensations. Safety and injury prevention. Lifting the hips reduces hamstring isolation and increases lumbar stress. Keep them down and engaged. Improper setup or overloading can cause knee discomfort. Adjust alignment and reduce weight if needed. Hamstring cramps are common. Stretch between sets and stay hydrated if they occur. Increase resistance over time, not too quickly, to give the connective tissue time to adapt. Variations and alternatives. Seated leg curl. Targets the hamstrings from a flexed hip position, emphasizing the muscle's lengthened range and reducing glute involvement. Standing leg curl, machine, trains one leg at a time, great for correcting imbalances and enhancing control across the full flexion arc. Cable leg curl offers more freedom in movement angles and body positioning, ideal for advanced isolation or rehab protocols. Dumbbell leg curl, a bodyweight-based variation done prone on a bench, holding a dumbbell between the feet, ideal for home or minimalist training. Mastering the lying leg curl builds strong, isolated hamstrings and deepens your understanding of safe and effective knee flexion training.